So here's my 2 cents worth about the coronavirus. I think it's being overrated. I think it's causing a lot of panic and stress. I think that we need to step back and to be able to look at the bigger picture. So here, look at some statistics. So far, the CDC, Center for Disease Control, has estimated that at least 12,000 people have died from influenza between October 1st, 2019 through to February 1st, 2020. And the number of deaths may be as high as 30,000. So if you look at that, that is a 4-month period, October 1st to February 1st. So let's look at the coronavirus. So 4,749 deaths, and I'm going to scroll down here. It started January 22nd, and almost 2 months, 4,749, and in 4 months could be as high as 30,000 deaths. So I'm just trying to put things into perspective. I think that we're just run by fear at this particular moment. So 30,000 in 4 months and 4,749 in almost 2 months, okay? I'm not saying this isn't a real issue, but the people that are dying generally have a compromised immune system. It's a virus, okay? Just like the flu. People have compromised immune systems, and I'm not sure if people realize this, but we're all going to die one day. And I'm not trying to make light of this. I really am not. But we have to look after ourselves. It's our responsibility to look after our immune system and not compromise it. So things like sugar. Sugar is one of the greatest things that is detrimental to our immune system. Stress, lack of sleep. Those are things that we need to, as individuals, to be able to look after for ourselves. And seriously, do we really need to be told that we have to wash our hands with soap and water? Come on. Do you know how many people died because of deaths of lack of sanitation? This is 2020. I live in Ontario, Canada. We should know and be taught and already know that we need to wash our hands with soap and water. Come on. It's our responsibility to look after our immune system. We have to think about maybe why are so many people's immune systems compromised and what has been happening to do that. That's not what I'm going to get into today. But again, look, almost 30,000 in 4 months from October 2019 to February 1st, 2020. And in almost 2 months, 4,749. So then let's look at this. So let's put things in perspective. Estimated number of new cases of cancer and deaths in 2019. It is estimated that, right, if we're looking here, almost 2 million cases, okay? 2 million, and almost 600,000 or over 600,000 died of cancer, right? And we're panicking about a virus. Now, I want to show you one more thing. So one of the things is, or a couple more things. So Trudeau, Prime Minister of Canada, promises $1 billion for research and readiness for the coronavirus, right? Well, by the time they get anything ready, the coronavirus will be over. They are going to need to spend that $1 billion on mental health issues because of the fear they've created. Because when we keep closing things and telling people that they can't be near people and we're closing things because of the fear of it, look what it says. Humans are wired from birth until the day we die. We need physical contact. And when we don't have physical contact, what happens is, and why it's important, skin-to-skin contact is vital for not only mental and emotional health, but physical health. So the thing we probably need the most, physical contact and security from our loved ones during this fear-driven coronavirus issue, we are now saying stay away from people, don't go near people, shut yourselves off. Let's close all forms of relationships and, self-contain yourself. And what we're going to end up with, more depression, anxiety, stress, difficult sleeping, and low, and then wrecking relationships, the little amount of relationships that people have now. So we will need to spend the $1 billion on mental health issues in Ontario. So people, calm down. It's a virus. 4,749 in almost 2 months. The influenza, almost 30,000 in 4 months. We need to calm down, take a breath. Don't let media, don't let the hype prevail over common sense. And remember, a happy heart is good medicine.